So this afternoon, I'll be talking about the power of mentorship in building strong foundation for nursing profession. Okay, next slide, please. The outline of the presentation is going to go thus. We'll introduce ourselves to mentoring. We'll talk about the history of mentorship. We talk about mentoring nursing, as the case may be. Then what are the stages of mentoring? What are the differences between being a preceptor that is reigning now, that nursing council wants, and being a mentor? Now, what is the power of mentorship, as the case may be? And what are the characteristics of an effective mentor? Then there's something we call toxic mentoring. This you will also learn. Mentorship is not a 21st century thing. No, absolutely not. But it had been dated far back, And when you look at mentoring, the history of mentoring comes from an ancient Greek poem. The man is known as Odes by Omar. And you realize that this man was going for war. And he felt, oh, how can I leave my child or my son without being attended to? As such, he then told someone to kindly assist the son with mentoring, to teach the son, and also to advise the son before his return. So you can really see that mentorship is not a new thing, and is not just dated to 21st century. The next slide, please. Now, what is mentorship? If you look at mentorship, many people, you will just see them, they'll be like, oh, mentorship. But precisely, what is mentorship all about? It is a process whereby an experience, you realize that thing is marked in red, highlighted in red. The person must be experienced, highly regarded, empathic person. So if you're talking about mentorship, it is a process whereby an experienced individual, highly regarded person, empathic person who serves as a mentor, guides another individual, the mentee, in the development and re-examination of their own idea. And at this juncture, you will learn that is from that mentor, personal and professional developments. So if you look at the mentorship process, it is all encompassing. It's not just living one-sided life. No, absolutely not. So it is a process by which an exceptional person that is highly regarded, empathic person who is a mentor guides you, all right, you that you are the mentee, in the development and re-examination of their own ideas, learning, personal and professional developments. Next slide, please. Who a mentor should be. If you look at that picture, you will see the mentor that is carrying like a water tank, and while the mentee is like a tree also trying to grow. A mentor should be the one, watering you as a mentee and see you grow as a mentee. So that mentor is watering you, and don't also forget that the mentor is not also going down. He is also developing himself, and at the same time getting you watered so that you can grow as an individual. So may I say that a mentee should connect, a mentor rather, should be able to connect you, should be able to motivate you, and that mentor should be able to make you have achievements and to ensure that you achieve. So when you are not getting this with your so-called mentor, then you know it is not appropriate. So know that your mentor should be the one, should connect you. And don't forget, as you're also growing, you will be connected. The mentor should motivate you. You're talking about resilience now. The mentor should be there for you, and the mentor should also ensure that you achieve. Let me cite an example. I was given an assignment at a department, and I felt, why me? This assignment is too big for me. It's not even it's beyond my position currently. And I spoke to my mentor. I said, Ma, that Professor Adejuma, I said, Ma, this position, I am not going to take it because it's beyond me. It is not me. And we have people that can do this. So why are they talking about me? Is it that they want the other thing from me? And she said, Iyanu, can you listen? I said, yes, ma'am. She said, these you are going to do and you do well. But these and these are the way to succeed. And ensure these are your goals and you must achieve them at the end of that tenure. And I said, really, ma'am? She said, yes. So we are talking about motivation. So you must be motivated by your mentor. And he or she must ensure that you do what you achieve as a person. Next slide, please. Now, stages of mentoring. You've been able to say, yes, I need mentoring. Or I need someone who is empathic. I need someone who can make me grow. I need someone who can get me connected. And I need someone who can also encourage me to have some level of achievements. As you're thinking about that, you should know that this thing goes in stages. So, stages of mentoring. The first stage of mentoring goes thus. You have contemplation. The next one is initiation. The third one is growth and maintenance. The fourth is decline and dissolution. And you have the last phase to be redefinition. What does contemplation mean? Next slide, please. Next slide. You see, before I start explaining this, I've seen cases where individuals or group of nurses feel that they are not teachable. So by the time you see yourself and as not being teachable, then it becomes difficult for you to have a mentor. So you must have it at the back of your mind to say, yes, I want to be teachable. And I also want to learn. Now, when you talk about contemplation, during the stage, what happens is that as an individual, you're interested. As a young nurse, you're interested. Oh, I'm interested in mentoring programs. Where do I pitch my tents? Oh, this is what I love to do. This is what I like to do. And at this level, you'll be looking for a good fit for whatever you think is good for you as a person. And you start picturing, oh, who do I want my mentor to be? Who do I want my role model to be? Who do I decide to be my mentor? And this is the first thing you look out for before you proceed on mentorship. At a time, my mentor discussed something with me, and I said, Ma, I am looking for. And I realized I got something on the net, and I went ahead to check it out. And on getting there, I realized that the individual was a virologist. And I said, oh, virologist? And the woman said, no, I'm ready to help you. I'm ready to do this. But I looked back and said, no, this is not what I want. I don't want to be a virologist. So why do I want to plow this route? So I had to withdraw. You see, you must really look for a good fit before you say, yes, this is what you want. Next slide, please. Next slide. Initiation. Now, at this level of initiation, you will realize that it's all about screening training, and final matching up, which we do in FYNI when you apply for mentorship. So we ensure that, oh, you have a good match up, we train you, then we screen you to ensure that, oh, this person fits in for the purpose that you want to do. And may I tell you that the first time you meet your mentor, that the first meeting that you have, you'll be so excited. In fact, you'll be very, very happy that, wow, I'm meeting this individual. I've been hearing about her. I'm seeing her for the first time. Oh, I'm speaking with her live and direct. You will be so happy. And this stage is called the courtship, the courtship stage, and what you call the fantasy stage. The next slide, please. Growth and maintenance. Still under the stages of mentoring. At this level, what happens? The relationship develops between yourself. The relationship develops between yourself and the mentor. Now, at this level, you realize that the relationship between you develops and you get more matured. The mentor-mentees become more comfortable with each other. So meaning that you build a relationship with yourself. All right. And when you do that, there's this connection. There's this connection that grows, and the trust is being built between both of you. And don't forget the fact that boundaries are set, and both the mentors and the mentees might be open to sharing personal information or even talking about topics that are deeper than what they discussed earlier in the match. Next slide. Next slide, please. Now, decline and dissolution phase. What happens at this level? The former mentoring relationship ultimately closes or end up once the period ends. Absolutely, it happens that way. And the goal in mentoring is for relationship to last even beyond what you expect as individual. However, don't forget the fact that along the line, you might not get along. It is not a crime. So don't see it as a do or die affair. If you are not getting along, then you resolve the matter and each and every one of you part way on good terms. However, it is always advised to end on a positive note because mentoring is usually beyond what we think, and it could last even beyond the formal that we think it could be. So don't forget the fact that mentoring or mentorship should close on a healthy and positive note. Next slide, please. Next slide. Now, redefinition. When you talk about redefinition, it is the final stage. And what happens at this juncture? So what happened is that it is the time where the mentor and mentee, what do? At this level, there could be complete closure, just the way I've explained earlier. And there could be continuation of match, as the case may be. And the continuing the relationship could even be outside the formal mentorship program as expected. And there could be a mentor mentee. Sorry, please. So at this level, you could realize that you could have a rematch, between the mentor and the mentee if they are not getting along, or if the individual is not getting what the individual wants. And may I also say that, just as I've told you earlier, that there's difference between preceptorship and mentorship. This is very, very important. So if currently you have a feeling that all what you're doing is all about preceptorship, and at the back of your mind, you're looking for a mentor, then today you should be able to readdress the situation to see if truly you are with a mentor or a preceptor. Now, mentorship and preceptorship. When you talk about preceptorship, then the individual is a teacher, the individual could be an headmaster, as the case may be, depending on the level. The individual could just be someone who shares skills, all right? And look at what Nursing Council is doing currently. Nursing Council is encouraging preceptorship on the wards. So when the nurses goes to the ward, they learn skills from the senior nurses, and from there, they're able to, improve their skills and bridge the theory gap of the practice theory gap situation. Now, for mentorship, this is the case. That individual must be an empathic person. The individual must be knowledgeable as a person. The individual must be wise and faithful counselor. Like, I listened to the question that someone asked and said, oh, the person told me that the senior nurse told me that I should not do my degree in nursing. And the person now went behind and did that same degree, advising somebody not to do. That is not a mentor, all right? So if you have such a person, you should know that person is not your mentor, all right? Because the person must be a faithful counselor. Now, why do we need a mentor? Why do we need a mentor? Next slide, please. Next slide. Next slide. Good. If you look at that diagram, you will see mentoring at the middle. So why do you need a mentor? One, you realize that the individual will advise you correctly. The individual will see you grow, being successful. And such a person will give you a proper direction, the right direction to go. And the person will coach you. The person will even support you, all right? Not just leaving you, and the individual will ensure that your own goal as a person is met. The person will also train you and motivate you. So if all of these are not in what you're doing currently with the person that you feel is your mentor, then you are not there. Next slide. Next slide, please. Next slide. Next slide. Okay. Now, let's talk about the power of mentorship. As an individual, as a group of person, as nurses, as young nurses upcoming, when you talk of power of mentorship, this is very, very serious and is germane to nursing. So we'll be talking about the power of a mentorship in terms of nursing and as well as other health professionals. So if you look at the power of mentorship, then you could go in this regard. One, just like I've said earlier, it helps you as a person to be properly guided so that you don't miss it. Like our mentors used to say, while they were growing, they didn't get this opportunity. They didn't have this opportunity at all. So we are lucky that we have people putting us in this guide. And when you don't have a guide, or you don't have a guidance, you don't have a support, you will only be on a spot and you'll be crawling. And you'll be wondering, is this spiritual attack? Is this something? But in the true sense, it's not spiritual attack. It's because you're not getting the right person to push you forward. And the power of mentorship could also be that it will also help you to have a constructive and honest feedback. Constructive and honest feedback. There was a day I was telling my mentor, I said, Prof, imagine I was called for a program and I gave this lecture. And after the whole thing looked so beautiful to me, looked so good. But at the end of the day, somebody just stood up and said, oh, your participants are sleeping. So what have you done? And I was so demoralized. And I said, Prof, imagine, see what this person said. My participants were sleeping, this, that. And Prof said, Iyanu, I said, ma, were your participants really sleeping? I said, actually, some of them slept. And Prof said, oh, beautiful. Anyway, now that you also know that they also slept, and the person also confirmed it to you, the next time, find a way of doing these, and these things to make them or to keep them awake. And I said, thank you very much, ma'am. You see, these are constructive feedbacks, for real. So they give it to you, and they also link you with persons that can also help you. You know, your mentor cannot do it alone. So if they feel that you need help in this area, then they make sure they push you forward to be able to get they serve as a link for you to be able to get to that target person that is expected of you. And then individual also serve as your role models, you know. So like they are rebuilding themselves in you. They are reinventing themselves in you. So in the next future, they are seeing themselves in you as their mentee, which they also expect you to mentor others, as the case may be. Then we have so many of it. I will not want to bore you. And it also builds confidence. Once you have this ability, it builds confidence and the likes. So please, can we move to the next slide, please? Next slide, please. Next slide. Next slide. Okay, so what are the characteristics of effective mentor? You said you have a mentor, you feel you have a mentor, you think, oh, I have mentor, this individual is superb, this individual is wonderful, this is the best person I can have. So what are we saying here? What are the characteristics of effective mentor, and not just a mentor? Now, when you say someone is effective, what is that person doing that really makes you to say this mentor is effective? Or do I need to change this individual? One, that individual sees themselves, that is, that mentor must be tactful. That mentor must be open-minded person. All right. The individual must be open-minded. Then the individual must be diplomatic, fun, and fair. Just the way we were told yesterday about leadership. You cannot be rigid. You can't just believe that it's all about you. All right. You should know that your mentor also share a part of you. Then the mentor must be willing to mentor you. When you call someone, a person tells you, oh no, I don't think I can do it at this time, giving excuses, always finding things that will not even make you to enjoy the person, then that individual is not an effective mentor. So the person must be willing. Then that individual must also have good knowledge base. So, and just the way Prof will say, blind cannot lead blind. It's not possible. This individual is not seeing road and you are following the person, you will not also see road. That's the truth. So that individual must be knowledgeable, okay, versatile, adaptable, flexible, very, very flexible and versatile. Let me share another story with you. While I did my master's program at Obafemi Awolowo University, Professor Adejumo was my external examiner. And when she was done and she left, and I was just there, my professor told me and said, Iyanu, I said, ma, that woman that just left, you need to get connected. And I was wondering, what is Prof talking about? And Prof said, while I traveled to Iowa, Prof also came to Iowa. And many of the things I could not do, Prof did ×2 of it, that she doesn't know where the woman gets this energy from. And I was like, really? Well. I said, thank God. So as of that time, I was working with the University College Hospital. So one day, I just went to the Department of Nursing, jejely. I said I was looking for Professor Adejuma, and I sat in front of him and I said, ma, please, I want to get my work published. And she said, really? I said, yes, ma. He said, okay, sit. And she said, this and this and this are what you are going to do. And I said, ma, but I've never done it before. I said, yes, we do it. And I'm looking at her like, what kind of wicked woman is this? I will do it. This I've never done in my life. And I'm not ready to give anybody to write for me. I need to do this myself. He said, yes, we do it. So just go to this, go to the internet, type Google, check for this journal, go to the author's guide, read the author guidelines. Once you read it, you know that it fits whatever you want to do, then you start the submission process. I said, really? She said, yes. And I did that myself. For 2 good years, I was running between corrections, editor correction, do it this way. I was running up and down, trying to sort it out. And when I was done and I got it published, she now met me on the corridor of University College Hospital and said, hello, I just went to meet her. Good afternoon, ma. And she said, I saw that you published your work. So welcome to the league. I was not looking at her, really? I said, thank God. So I'm a mini professor, and, and see how the whole thing started. Because somebody told me she's agile, she's versatile, she has the knowledge. So I started running after the woman just to be able to acquire such. That's who they can be. And for effective mentor, that individual must allow time and commit themselves to confidence. I tell you, if Prof Adejuma wants to do something and you pin her down, she will do it and do it well. So I'm always happy when she gives me an assignment to do. I know that, no, that assignment cannot go out raw, no matter what. Once I'm done, send it to her. She will look at it, give it a clean look, do the needful. And when it comes back to you as the mentee, you'll be happy that you get a mentor your work to look at. And that is the beauty of what we're talking about. The time is not there for them as such, but when that time they have it, they make use of it very, very well for their mentee. Now, an effective mentor has a good communication skill, including listening, and the individual is also happy. When you have someone that cannot even listen to you, then there is a trouble. So ensure that that's your mentor. For it to be effective, must have a good listening skill. And Prof will say, okay, what are you talking about? Ma, this is this, this is this, this is this. Ma, can we do it this way so that we can have this result? She said, okay, that is good. Let's go that route. But I just feel this is also better. And that is what you can get from them. Now, the person must also be a very good advisor, must provide encouragement. There are times that we're talking about is resilience of a thing. And you can see the way Dr. Akinbade spoke about it with passion, resilience. But when you don't have a good mentor and you say, ma, that thing I'm not doing again, no. She will say, okay, it's okay. Don't do it now. And you feel the person is helping you. The person is not helping you. When I was going to win my first grants, I spoke to my supervisor. She said, are you sure you'll be able to do this? Because somebody did it at this time. The person did not get it. I said, yes, ma, I think I will try. And I went to meet Prof, my mentor. I said, ma, this thing I want to do, I've tried it before. I was not given. But this time around, I think I've reworked it. I think I can get it, ma. He said, really? That she's traveling out of the country, but let her look at it for me. And she said, Iyanu, okay, this and this method. Why can't we use this method? Why this method? Okay, do it this way, do it this way. And I did it that way. And I got it. So these are individuals you're talking about. They advise you, they encourage you, you are falling, they keep pushing you, they want you to get better each day. And they self-motivate you, and you can trust them. When they tell you this, then they will do it. And if it's not in their capacity, they'll say, no, at this time, I cannot do it. Effective mentors. They show concerns. They have compassion and they have empathy. Even when you wrong them, Prof will tell you, oh, this is your number one. I feel because it's your number one, you did not get it right as well. So this is your number two. So even you will not want to do number 3 because you have been guided and you have been told. So all of these, they are very, very important as when you are an effective mentor. Then at the same time, you should be empathic, and you should have in the true sense, they should be your role model. So it's not that do what I say and don't do what I do. They are not that kind of individual. Absolutely not. Then, talking about toxic mentoring. Now, we have been able to find out who effective mentors should be. Now, there's something we call toxic mentoring. So when you find yourself in this situation, then you should know that it's already becoming toxic and it is time to opt out. 1, when that mentor lacks interest in the students or their learning needs. We have some of them like that. They just feel, oh, you're not just good enough for them. You're not just okay for them. They are the best, and they have some group of people that are very good for them. Then you should know that that mentoring is becoming toxic. Then you exit. Then lack of knowledge about the student or the new nurses course. So you have a mentor, you feel that mentor is grounded in genetics, and you go to see and realize that, oh, she doesn't even know anything about genetics. And that is what your passion, what you want. Then it's not a good route for you. The lack of evidence-based practice of research utilization. Just the way Professor Adebayo Adejimo just told us this afternoon, he reads a lot, he learns about new things, is current about things. You know, when you're a professor, you know so much in a little place. I mean, a little environment, you know so much in it, and that's why you're a professor. So now this individual is not even grounded. He doesn't know so much in the little that he finds himself, then is not healthy. There's no acknowledgement of the new nurse's previous experiences. The person has a negative attitude, reluctant to change in practice. You know, all of these things will show you that this thing is becoming toxic as a person. Now, what are the do's and don'ts of mentors and mentees? 1, when you find a mentor, these should be the do's of the mentors. 1, your mentor should be available. I've just told you, should be available for you. Your mentor should convey respect and confidence. Your mentor should be able to focus on you as a mentee. Then you should be able to ask questions. That is, that mentor should be able to ask questions from even the mentee. Then the mentor should be able to track your progress. It's very, very important. And identify your strengths, give feedback to you, and also make reassessment of you. Is very, very important. And what about the don'ts of a mentee? So a mentee should not promote his or her own agenda on that mentee. So if you're a mentor, it's not that, oh, you must know this is what you just have to do. No. Then you must, at the same time, you must not use your mentees for free labor. Oh, I've seen cheap labor. Now this one I'll use for this purpose. No. You shouldn't see them as free labors. And you can't be taking credit to what you did not do. And that's what I really appreciate of my mentor. If she gives you an assignment to say, okay, please prepare this slide for me for this use, and she gets to that grant, she will tell you, oh, this is the voice of Jacob, but this is the handwritten of this person. And she will say, oh, I acknowledge this, my mentee that prepared this for me. And that does not limit her as well as the mentee. Now, what are the do's and don'ts again? For mentees now, what are the do's of mentees? You are expected to be punctual. You are expected to follow through. Some of us just feel that the mentor must be the one calling us. No. Even you as a mentee, you must follow through your mentor. Then you must also set agenda for yourself. You must communicate. It's very, very important. You must accept criticism. Yes. There was a time I said, I'm my mentor, we discussed something. And she told me, yeah, this is the feedback she got from this person. How do you think we can build this? We can manage this and all of that. So I got the feedback, and I need to work on myself to be able to be better. That is very, very good. Then you must accept, you must convey respect yourself. You must accept challenges. There are some things that yourself and your mentor will set out to do and be like, oh, nobody has done it, but you must really accept those challenges. We have been taught resilience, and your breakfast is what is challenges and obstacles. So you should know that you're in the right place. So you must really accept challenges, and you must show appreciation. Is very, very, very important. Many of us, we do not, and we just feel it's your right to be mentored, but it's not. The individual can decide to leave you and not mentor you. So you must be appreciative at all time as a mentee. So what are your don'ts? Avoid decisions, just taking radical decisions without informing. There was a time I made this mistake. Yes, I didn't know. I just felt I was just enjoying myself. And an offer came, I just keyed into it like that. I'd forgotten that decision needs to be reached. I need to discuss with my mentor. And it got to a time I just realized that, which route are you going, Iyanu? You need to discuss this. And I had to call my mentor to say this and this. I said, no, that is not the way to do it. Even if you want to do it, this is the way to go about it. And since that time, I got a good, a wider horizon to say, okay, if one is going this way, this is what is needed for this area. And since that time, I don't even make such a mistake. And this is what is expected from us. So then you can't rely exclusively on your mentor. No, it's not absolutely, it doesn't work that way. Then we call something acquiescence. That is, when you just reluctantly, okay, ma. Okay, ma. Within you, you're not ready for it, but you just want to, please, and just, okay. But you need to talk about it. That is your don't. You don't have to do that. Then you cannot have over idealization. No. Somebody must guide you to be able to, accomplish all of that. Now, what are the building strong that when you want to build a strong foundation in nursing mentoring, what do you think of this will amount to? One, as a person, you realize that for nursing profession that we are talking about currently, it will help nursing recruitment and retention. Because the truth of the matter is that when I see that as a nurse, I don't have a mentor, nobody's to guide me, then I leave. I don't find anything beautiful. I just go. I had the case then that I had someone that told me, oh, madam, you have conflict of interest. Can't you go this route? This route, don't you think this route is better? And I looked at it and said, is I see this individual that I'm looking up to as mentor, I don't think this person is a good fit for me, because it's another thing I'm thinking about, is another intention this individual has. And I had to retrace my step. It was very hard and difficult for both of us, but we still had to move. So these are things we're talking about. So for you to talk about building foundation in terms of nursing mentorship, once these foundations are built, there'll be retention and everything will be fine with nursing. Then there will also be nurse satisfaction. Absolutely. Because you know what you're doing and you're enjoying what you're doing, you're moving along with your mentor, then all is well with you. You're breaking grounds, you're having groundbreaking researches, cut across researches, you're doing well, then you will be satisfied being a nurse. And all of these that we're talking about will also help you in your personal development, career, and go. Very beautiful a background for you to leverage on. Then may I say that this is an opportunity for you that you are here right now. We have the FYNI, that's the Young Nurses Association initiative by Professor Mrs. and Professor Mr. Adebayo Adejimo, that they have put on board for us as nurses. As we're growing as young nurses, let us leverage on this foundation. Let us leverage on this, this initiative. It really helps us as a nurse to really build our mentorship growth and our career. We have the academic career, we have the the clinical career, whatever career like you want, we have this in this foundation. So our advice for many of you that you don't know, or you want to talk to your friend about it, this is a good place to be. I mean, so once the call is out, please kindly apply so that you can get more of these practical sections we are discussing. Next slide, please. Next slide, please. Next slide. Next slide, next slide. Okay, so in conclusion, mentoring plays an important role in developing the potential in new nurses. So as we are young nurses, even I myself, as I'm growing in the profession, it helps me, and it develops us as individuals. Still will also grow to be what they call super mentor, just the way Professor Adejimo used to tell us, and we keep growing and growing and growing in the profession, become more satisfied. There's more retention in nursing, as the case may be. So finally, I would like to say thank you for listening to me. So don't forget that you need mentor that has what? That is empathic, a mentor that has a knowledge base, and a mentor that will definitely help you to achieve your personal and your professional career to be developed as an individual. Thank you, and thank you. God bless you.